COPD, or chronic obstructive pulmonary disease, is a collection of illnesses like chronic bronchitis or emphysema that involve the respiratory system of the human body. In a healthy individual, after oxygen makes its way through the trachea, it moves into the bronchial tubes, and from these tubes, oxygen is dispersed all over the lungs via the bronchioles. Alveoli, structures that resemble small sacs, are situated around the end of the bronchioles. Millions of these little pouches are found in the lungs, and they are why oxygen is able to enter the bloodstream and why carbon dioxide is able to leave it. In an individual with COPD, however, this process is much more difficult. These people generally experience compromised airways, like the bronchial tubes, in addition to alveoli. The simple act of breathing can become vastly more complicated with the prognosis of COPD, a condition that attacks his bodily function. In order to breathe normally, specifically, the well-being of one's bronchial tubes and alveoli is imperative. The bronchial tubes permit air to move inside the body and later outside the body. The alveoli act to exchange gases with the capillaries, and without them, body tissues would never receive the oxygen they rely on. These organs form part of the foundation for the respiratory system, and because of this, COPD has the potential to inflict lasting damage to these components of the lungs. In the medical community, chronic obstructive pulmonary disease primarily refers to either chronic bronchitis or emphysema, each affecting separate aspects of the respiratory system. As implied by the name, chronic bronchitis is an illness concerning the bronchial tubes. The onset of chronic bronchitis begins when the various airways found all over the lungs begin to swell and heighten the quantity of mucus they give off. The mucus buildup, in particular, is a result of cilia, microscopic hair-like projections covering the inside of the lungs' passageways, not being capable of transporting an adequate amount of mucus. Coughing is the only way mucus can leave the body, so when the cilia become injured or altogether non-existent, the vast majority of the substance is left sitting in the bronchial tubes. Emphysema, on the other hand, applies to the part of the respiratory system known as the alveoli, a key component of internal respiration, which quite literally parallels what a grape bunch appears as. The development of this disorder is induced when the alveoli, along with their thin walls, undergo some negative mutation that leads them to capture excessive amounts of air. Alveolar flaws may appear as trouble with expansion as well as enlarged or defective alveoli, a byproduct of cell wall failure. After the alveoli pick up an overabundance of air, the lungs, as a result, also inhale an unhealthy amount of air, which alters how breathing transpires. Because emphysema leads to ineffective exhalation and chronic bronchitis is associated with the narrowing of the bronchial tubes, multiple health-related consequences are soon to follow. Symptoms of COPD can vary and are often quite serious, sometimes even life-threatening. One diagnosed with COPD may experience prolonged coughing, lack of adequate ventilation even when engaging in common activities, recurring infections concerning the respiratory system, discolored lips or fingernails, wheezing, compressed sensations in the chest, and general tiredness. The range of intensity for all symptoms concerning COPD is quite broad. It is not uncommon for individuals to be able to control their illness with just minor adjustments to their way of life. On the other hand, if an individual's lungs have already endured extensive deterioration, smoking usually being the culprit, then their COPD turns into a much more detrimental condition to live with. COPD's scope of damage for these people goes much farther beyond the respiratory system. It, in fact, may begin to negatively impact other systems or organs within the body. Smokers who acquire COPD can expect to encounter swollen ankles, legs, or feet, noticeable reductions in weight, and even impaired muscle capabilities and stamina. Ultimately, smokers with COPD will likely find themselves being diagnosed with hypoxia, a malady where critical organs aren't supplied with suitable levels of oxygen. This disorder is accompanied by increased blood pressure or a broad feeling of disorientation. Even though chronic obstructive pulmonary disease is not an easy medical disorder to live with, revolutionary treatment options have allowed all people who suffer from COPD to live happier and healthier lives each day. As of right now, a good portion of COPD subjects have been prescribed one out of many different inhaler options, which, as a matter of fact, frequently turns into a costly and ineffective way to care for the disease. Ongoing studies have uncovered several therapies that are more effective for diagnosing and controlling COPD, many of which have actually eliminated the need for traditional pharmaceutical medications. For instance, researchers have been investigating a novel diagnostic procedure that has been dubbed PRM, or parametric response mapping. This imaging system, designed for people living with COPD, does not penetrate the body and is capable of pinpointing locations of minute anomalies present within the immense network of airways. Additionally, COPD patients are now having their blood tested, something previously done for people just with asthma, for the reason that healthcare professionals are able to use the information to match a patient with an appropriate drug or drugs. These blood tests detect a person's eosinophil count, a category of white blood cells, and with that data can a specific set of biological drugs be deemed fitting or not for an individual dealing with COPD. Some of the most exciting avenues for treating chronic obstructive pulmonary disease is within stem cell therapy in conjunction with innovative strategies concerning surgical operations. In the realm of surgery, Physicians are now taking advantage of all the leaps and bounds made throughout the robotic industry within the past few years. LVRS, an automated medical tool which eliminates the necessity for sizable and intrusive incisions, has recently been implemented into a few U.S. hospitals. Using LVRS, only three minimal openings are required for the machine to extract diseased sections of lung tissue, which ultimately reduces the amount of pain COPD sufferers have to endure on a day to day basis.